Good evening, I'm Dr. Suresh Sankar. I'm a nephrologist at VS Hospital, Kilpauk, Chennai. In modern day medical care, the common diseases that adults get treatment from physicians and specialists are diabetes, high blood pressure, heart conditions, and kidney disease. And what is a common trend now is a lot of treatment and tests that used to happen in the hospital can be done easily in a lab and at home and even by patients themselves. Example is blood sugar testing. You don't need to go into a hospital or a lab. You can do it at home with a hand prick. I think the next important change that has happened, which a lot of patients are not aware of, are not doing enough, is actually home monitoring of blood pressure. Our blood pressure is like our mood. It tends to change every single minute. And what matters is what your blood pressure is most of the time, and not when you see a doctor in a clinic every 4 months or 6 months. And it is also known when you come into a doctor's clinic or into a hospital, you are more anxious, you're worried about the conversation, so naturally your blood pressure is higher. To a point, this is called white coat hypertension. So what happens in the real world is your blood pressure is fluctuating up and down. When you come into the doctor's office, it's more likely to be higher. A doctor measures that blood pressure, and then you think all the time the blood pressure is that level, which is a wrong way of looking at blood pressure. We have learned from good research and modern day technology that a patient measuring the blood pressure at home by themselves is a much better practice to know the truth about the blood pressure, to manage heart disease better, and to manage kidney disease better. The bottom line, start the practice of monitoring blood pressure at home. There are very easily available technology that are compact and easy to use, and it's inexpensive. These are automated blood pressure apparatus which you can slap it onto your arm and you just press a button. In about a few seconds it will show you your blood pressure. I appeal again for anybody who's got high blood pressure, practice self-monitoring of blood pressure at home. Thank you.
VS Hospitals. Care, cure and compassion.